The seborrheic otitis externa are the reactive group of inflammation of the ear canal. In cases of the seborrheic otitis externa, it is associated with the seborrheic dermatitis of the scalp. There is the seborrheic dermatitis of scalp. Itching is the main complaint. Greasy yellow scales are seen in the external canal. Greasy yellow. The greasy yellow scales are seen in the external canal in cases of the seborrheic dermatitis. The seborrheic dermatitis is the seborrheic dermatitis of the scalp. Greasy yellow scales are seen in the external canal, and the main complaint is the itching. Itching is the main complaint of the patient. Main complaint. Treatment in case of the seborrheic dermatitis consists of air toilet. The treatment is the air toilet. We clean the ear, and these greasy yellow scales are removed from the external canal, and application of cream containing salicylic acid and sulfur, and attention to the scalp for seborrhea. We use the salicylic acid and sulfur cream. Salicylic acid and sulfur cream. Sulfur cream for the cleaning of the ear and the seborrheic dermatitis of the scalp. So we must clean these dermatitis, and these yellow greasy appearance are seen on the scalp. The ecchymatous otitis externa are the second reactive group of the inflammation of the ear canal. The ecchymatous otitis externa is the hypersensitivity reaction to infective organism or topical ear drops such as chloromycetin or neomycin. Their hypersensitivity reaction of the infective group are the ear drops. The ear drops are involved as chloromycetin and neomycin. These drops, when we use for the infection of the ear canal, there may be hypersensitivity reaction. They cause the ecchymatous otitis externa. The complaint of the patient is the intense irritation, vesicle formations, oozing, crusting in the canal. There is intense irritation. Presenting complaint of the patient is intense irritation, vesicle formation, and oozing and crusting in the canal. The treatment for the ecchymatous otitis externa is the remove or withdraw these ear drops, that is chloromycetin and neomycin, with alternatives. These causing the sensitivity reaction, and we use the steroid cream for alternative using of steroid cream because they are the hypersensitivity reaction. The neurodermatitis or the compulsive scratching due to psychological factor. The neurodermatitis caused due to psychological factor. In the case of the neurodermatitis, there is intense itching. The patient presenting complaint is intense itching. These intense itching cause the neurodermatitis. Otitis externa of the bacterial type may follow infection of the raw area left by scratching. The treatment for the neurodermatitis is the sympathetic psychotherapy are the main treatment, and antibiotic also used for any secondary infection. The main treatment is the psychotherapy, that is sympathetic sympathetic psychotherapy, antibiotic drugs for secondary infection, and ear pack and bandage to the ear are helpful to prevent the compulsive scratching. Ear pack and bandage are also helpful for the prevent compulsive scratching. In neurodermatitis, there is the compulsive scratching. This is the psychological factor involvement, and the present in complaint is the intense itching. The treatment is sympathetic psychotherapy, antibiotic for secondary infection. Ear pack and bandage are also useful for preventing this scratching.